Hi, this is Jen Kay, and I'm here at the Arizona Natural Health Center in Tempe, Arizona. I am so excited and honored to be hosting this segment of natural remedies for common and sometimes not so common conditions. Today's segment focuses on fibromyalgia and how this disease can be treated with natural remedies using a whole person approach. It is my special honor to be introducing to you today Dr. Denise Haller, who is one of the amazing doctors here at the Arizona Natural Health Center. Dr. Haller, welcome.
Hi, thank you.
You know, a lot of people, so much more today, we're hearing about fibromyalgia more than ever. Can you please enlighten us as to what fibromyalgia really is and what are some of the common conditions or symptoms associated with it?
Sure. Fibromyalgia can look different in different people, actually making it hard to diagnose, and some people can go undiagnosed for some time because of this. The most common symptoms seen, though, are pain is the top by far, and it is diffuse body pain, achy pain that is persistent, accompanied by fatigue. And this is physical fatigue, being hard to move around, feeling really tired, but also mental fatigue, very hard to think, brain fog, as they say. And this fatigue is beyond just being tired. It's hard for these people to go about their day-to-day activities. Also, these people can feel have difficulty sleeping, and trouble sleeping or difficulty attaining the deeper levels of sleep, the more restorative sleep.
So more superficial.
Right.
Okay.
Therefore, they're feeling very unrefreshed, and this can exacerbate the symptoms of fibromyalgia.
Sure. So here's my question for you. With more people than ever being overwhelmed, stressed out, job conditions keep changing, how would someone actually know if they have fibromyalgia?
There's unfortunately no lab test or imaging study that is definitive for the diagnosis of fibromyalgia. There are, if your symptoms match up, is one way to know. There is another test you can do, which is to see if people have 11 of 18 tender points throughout the body.
Okay.
If 11 of 18 are tender, it can be another diagnostic criteria for fibromyalgia. And the rest really being if the rest of the symptoms match, and again, it can look different. So it can be hard to diagnose, and a lot of these people go on for some time being undiagnosed and therefore untreated.
That is fascinating, and at the same time sounds so frustrating.
Yeah.
So once, let's say, someone recognizes that they might be in that need and maybe even have the diagnosis, how is fibromyalgia then treated?
Conventionally, it's treated basically by trying to palliate the symptoms. Conventionally, the treatment is if they can make the patients more comfortable, then that's their goal. So obviously, over-the-counter pain relievers, ibuprofen, Tylenol, these things can work for short periods of time to relieve some of the physical pain. SSRIs, such as Prozac or other antidepressants, are commonly prescribed for these patients because one of the theories as to the causes of fibromyalgia is low serotonin levels in the body.
Okay.
There's one drug that was recently approved by the FDA for the use in fibromyalgia, and that's Lyrica. A portion of people who take Lyrica actually have amelioration of symptoms, but of those people, only a certain number of them can tolerate the side effects, unfortunately. It produces some pretty intense side effects, and so if they can tolerate those, they can get some relief of the pain and fatigue of fibromyalgia.
Sure. So as I understand it, and so much of what we hear is it comes to the conventional approach of medicine, which certainly serves a purpose.
Absolutely.
And yet there's so many associated side effects sometimes that really comes with that, right? You have another way of approaching these types of conditions for fibromyalgia at the Arizona Natural Health Center, don't you?
Absolutely.
Will you tell me a little bit
I
more
would
about
love
that?
to. Treating fibromyalgia has been very rewarding for me in my practice because I've gotten wonderful results, and it's so great to watch these people who suffer so horribly get better from visit to visit. You see them regaining their freedom and their health, and there's just nothing better than watching that process. And like I said, that's with using homeopathy. So how homeopathy is different is it addresses the body on such a deep level. It doesn't just treat the symptoms. It actually stimulates the body to be stronger and healthier, therefore not being able to have disease, essentially. So the beauty of homeopathy is it can address multiple symptoms at one time. As I mentioned earlier, fibromyalgia has many symptoms, including mood changes. And with homeopathy, it can address the pain, the mood changes, and the fatigue, and most importantly, I think, the sleep.
So homeopathy addresses the pain, the mood changes, sleep, and anything that comes up with that without additional side effects. Is that correct?
Absolutely no additional side effects, but the medicine is very individualized. So let's say I have 10 patients with fibromyalgia. Most likely they will each need 10 different remedies based on their individual expression of fibromyalgia, individualizing treatment. So I really need to spend a lot of time with these patients to understand their specific expression of the disease and then match it with the proper homeopathic medicine to achieve the best results. And when this can be accomplished, the results are truly amazing.
Well, I can certainly speak from personal experience. I thought, our initial intake, you spend so much time asking question after question and everything from the environment and where each person is at. I know how much care and love and compassion you have for your patients, and the time and the energy that you put into getting to know who they are so that you can, without a doubt, find the right treatment for them.
I'm really committed to getting people better. That's what brought me into the business of healthcare and finally naturopathic and homeopathic medicine, because it was the way that I found to most directly get people to a high state of health with the least side effects and sufferings along the way. So we have to take the time and be true detectives to find out where have they been, what has worked, what doesn't work, what makes them different, to really listen to our patients, where sometimes they feel better just from being heard. It's amazing. And then to find the appropriate medicine to help them to stimulate their bodies to heal themselves essentially, and or to be in a higher state of health where disease can no longer be.
Well, it's brilliant. And I certainly know from personal experience, I know that this natural approach makes so much more sense. I carry my remedy everywhere, but I know the question on so many people's minds, the bottom line is this: yeah, but does it really work?
Absolutely, it works. I watch it work every day that I'm here. And if it didn't work, I'd be finding something else to do, because my commitment is to make people feel better and to free people of suffering.
So I know that you have so many success stories about patients who have released pain and gotten so much more out of their lives and reclaimed their freedom, independence, and emotional happiness. If someone, I think, has fibromyalgia, or if I did, is it as simple as coming to see one of the doctors here at the Arizona Natural Health Center?
It truly is. It's that simple. There's also lots of things people can do at home if they think they have fibromyalgia or know that they have this disease, to help themselves and to get them off on the right foot.
Like what? So
first is exercise. And I have to give a plug to yoga here, because people with fibromyalgia, as I said, there's many symptoms, and there are emotional symptoms as well as physical symptoms. And the mind-body connection is just undeniable. And yoga is such a great practice that it takes that connection into consideration. And people have they feel better physically and mentally and emotionally because of the practice of yoga and what it offers. Also, something as simple as walking can be incredible. Continuous exercise releases endorphins, and endorphins do so many magical things for people, especially people with fibro.
And all the side effects are good ones.
Exactly.
Right, okay.
This is exactly the case. So endorphins are natural painkillers, which obviously people with fibro will benefit from. Endorphins also help promote deeper sleep, appetite suppression, and mood elevation. So doesn't this sound like the perfect recipe for someone with fibromyalgia?
Count me in.
And it doesn't take that much either. 30 minutes a day of walking, or even 15 minutes a day of walking is enough to get some of these effects. Diet is essential. It really is. And it's about removing the foods that can harm us and adding more of the foods in that can heal us.
Can you give us a couple of examples?
Sure. So taking foods away that are actually toxic to our body. What I found, and what has been noticed with people with fibromyalgia, is they're more sensitive to their environment. So toxins in our foods, our environment, affect these people more profoundly than maybe you or I. And they're going to react more strongly to toxins in our foods or environment. Mm-hmm. So I'm going to speak of two flavor enhancers, one aspartame and MSG. These are used widely in our foods as flavor enhancers, and they're known as neurotoxins. And people with fibromyalgia, when they're asked to remove these from their diet, can get great amelioration of their pain and symptoms just by removing the toxins from their diet.
So say that again,
aspartame is a sweetener,
Okay.
often found in lots of diet soft drinks.
Okay.
And MSG is a flavor enhancer, found in lots of foods, unfortunately.
Okay, so look for those on the labels and don't eat them.
And if you strictly avoid those, lots of people with fibro have relief. And adding in foods that are, simply whole grains and fresh fruits and vegetables contain so many wonderful vitamins, minerals, and antioxidants that help fuel a disease-free body. You're doing yourself a big favor by adding these into your diet. And what I tell people, when I tell my patients, is if they're having trouble removing the foods they know aren't so good for them, just add in some that are, and that shift will happen naturally.
So you don't like broccoli, work it in a little slowly,
Exactly.
and you'll eventually like it.
That's right.
Great. Thank you so much for making the time. I know as a full-time mom with 2 young boys, this took time out of your schedule. I can't thank you enough for making the time to be here today.
Thank you.
You bet. I hope that you have found today's segment on fibromyalgia especially helpful, and I strongly encourage you to see the other videos in our series. I'm Jen Kay, and on behalf of myself and the doctors at Arizona Natural Health Center, we appreciate you taking the time to watch and look forward to seeing you again.